Ever wondered what happens to your body when it gets injured or experiences trauma? That's where inflammation comes in. Welcome to MedExplain. Today, we're diving deep into the mechanism behind it. Let's get started. What is inflammation? It is a body's defense response aimed at eliminating or limiting the spread of harmful agents, followed by the removal of the necrosed, that is, the dead cells, and the repair of damaged tissue. In 1st century Rome, a dude named Celsus defined the 4 classic signs of inflammation. Later, good old Virchow added the 5th one. So here they are, one by one. Rubor, redness. When your body senses an injury, it sends more blood to the area. More blood means more red blood cells, that is redness. Simple. This happens because of vasodilation. Your blood vessels widen to bring in immune cells. Second one is calor, that is heat. With all the extra blood rushing in, the area definitely feels warm. Your body is basically turning up the thermostat to speed up healing. It's like your immune system is saying, we gotta cook this infection out. Third one is tumor. Swelling basically happens because immune cells release chemical mediators that make blood vessels leaky. This lets plasma and proteins escape into tissues. Boom! You get swelling. It's like your body's defense squad is setting up a camp at the injury site. Fourth one on the list is dolor, that is pain. Pain is your body's way of saying, hey, don't mess with this area. Chemicals like prostaglandins irritate nerve endings, making the site sensitive. That's why even a small touch can feel like stepping on a Lego. This last one, that is loss of function, was added by Virchow. If the area is swollen, painful, and full of immune activity, you won't be able to use it properly. Like how you can't walk properly when you twist your ankle, your body is forcing you to rest so it can heal. Alright, quick recap. Redness, heat, swelling, pain, and loss of function. Next time you get a mosquito bite or a cut, you'll know exactly what's happening. We have basically 2 types of inflammation, acute and chronic. Acute inflammation is rapid onset, short duration, and the outcome is edema with aggregation of neutrophils. Chronic inflammation is late onset, hence long duration, and the outcome will be a granuloma formation with aggregation of macrophages and lymphocytes. We have basically 2 events involved in acute inflammation. One is vascular and the other is cellular. Let's have a quick overview of the vascular events involved. The first one is transient vasoconstriction of arterioles. Second is persistent progressive vasodilation. Third is elevated hydrostatic pressure. And fourth is increased vascular permeability. And the last one is stasis. Vasoconstriction is the very first response of blood vessels to injury. It is temporary and short-lived reaction lasting only few seconds to minutes. When a tissue is injured, the small blood vessels temporarily narrow or constrict to minimize blood loss and reduce exposure to harmful agents like bacteria or toxins at the injury site. This constriction is mainly controlled by reflex neural mechanisms and the release of vasoactive substances like endothelin from the endothelium, as you can see in the picture. This endothelin causes vasoconstriction to limit excessive blood loss and reduce the spread of harmful pathogens or toxins, thus preventing further damage by reducing bleeding. But here is the key. This vasoconstriction is very brief. It's immediately followed by vasodilation. Since there is trauma or injury to the blood vessels, the body detects the damage and triggers activation of mast cells. These mast cells release chemical mediators like histamine, bradykinin, and prostaglandins that act on endothelium and help in its relaxation, resulting in vasodilation, that is, widening of the blood vessel. So eventually there will be increase of blood flow to the site of injury or infection. This presents as the cardinal signs, mainly rubor, that is redness, due to increased blood flow in that area, and calor, that is heat, due to higher temperatures brought by the warm blood. The goal of vasodilation is simple: increase blood flow to the injured area. More blood means more oxygen, nutrients, and immune cells rushing in to start the healing process. Due to this vasodilation, more blood enters the capillary beds. So there will be an overall increase in capillary hydrostatic pressure. That is, the pressure exerted by blood against the vessel walls. This results in more fluid coming out of the capillaries, causing edema that manifests as the cardinal sign, that is swelling, tumor, or pain, that is dolor. Swollen tissues often put pressure on the nearby nerves, hence pain. As we know that in response to the injury, mast cells release histamine, bradykinin, leukotrienes, and prostaglandins. This causes contraction of the endothelial cells, that is lining your endothelium of the blood vessels, causing small gaps between them. Through these small gaps, fluid, proteins like albumin, and immune cells like neutrophils leak out. This results in edema due to reduced oncotic pressure, as there is a lot of loss of albumin, and neutrophils moving out results in diapedesis. The last step is stasis. As we know that plasma leaks out due to the endothelial gaps causing edema, blood eventually in the vessels becomes thicker, that is increased viscosity. Due to this thickness of the blood, the velocity of the blood flow reduces or decreases. Eventually, the WBCs, that is white blood cells, move from the center of the bloodstream to the edges of the vessels. This process is called margination, and this prepares further exit into tissues, that is called diapedesis. Finally, they migrate to the site of injury for effective defense and repair. All these early vascular responses in inflammation results in classic physiological reactions of the skin to injury called as triple response of Lewis. It manifests as a red line due to local vasodilation of capillaries, a flare, which is a bright reddish surrounding the red line due to vasodilation of adjacent arterioles, and a wheal, swelling due to transudation of fluid into extravascular space. Alright, here is a tricky question for you. Listen carefully. Which of the following is the primary mediator responsible for the initial vasodilation response in acute inflammation? Option A, histamine. Option B, prostaglandins. Option C, leukotrienes. And option D, bradykinin. If you know the answer, drop it in the comments below. Alright, if this video made inflammation less of a headache, then hit the like button. It's free, but it keeps the grind going. And if you're new here, subscribe for more no-nonsense medical breakdowns. Oh, and don't be selfish. Share this with your friends who might need a quick revision. See you in the next one. Stay sharp, stay savage.